After treatment for a few weeks, do you stop the treatment, or is it continued in a lower dose, or is there any chance of recurrence in such cases, sir?
Usually, I ask them to go with the treatment till all other parameters of what we take it as a consideration, and the modern parameters like prothrombin time, LFT, and even ultrasonography of abdomen. All these things are kept as a markers for our study. So I'll use all those tools and imaging techniques and laboratory techniques. Usually, whenever I get totally LFT is normal and hemoglobin level is normal, ESR is normal, prothrombin time reaches to normalcy, and there is no free fluid in the peritoneal cavity, and all these things, if it is settled down, only then the coarse texture of the liver will remain, or nodular surface of remain will remain, and sometimes there may be some slight portal hypertension, such type of things will come. Other rest of things will be almost becomes normal. In such a condition, then I will wait till that to achieve. So that to achieve that usually takes 100 days to 200 days to achieve this. So once that is achieved, afterwards then slowly tapering, I reduce the dosages of the medicine and I will try to maintain till the completion of 1 year. But you should, once totally 1 year is completed with the medication and things are totally normal, then I will stop the medication. And relapsing in these type of cases is very common. Relapsing will be there if the patient doesn't follow the patya later on. Then there is a real chance of getting disease once again back. But I have one case. I had a case that he has come to me with the same type of condition in the year 2000, and that time he has very clearly taken the medicine, and everything was went into normalcy. He lived after up to 18 years without any complication. After that, and in the 20th year of the starting from the earlier time, 20th year, he developed almost similar condition, but this time I could not make him to survive. So that's the reason. There may be chance of repetitions. So we need to be very clear and very careful in handling this and even conveying the things to the patients. So what should be medicine should be taken, how long, and what should be the time or duration required, what may be the outcome, or what may be the future problems we may face. Everything we need to discuss with the patient before handling these things. But many times what I get usually these patients, they have already gone to different doctors and different specialities. They've already tried and they got a lot of experiences of all these things. Then they will come to me. So by the time they reach to me, they'll become old patients of CLD, and they will be having almost many in basic ideas about this disease. But they are only one thing they ask is, somehow you try to save me. So that's what they usually ask, and that depends on person to person and the patient to patient. So how they follow it and how their body supports the medication and everything.
And how to determine the prognosis? Is there any age that you have noticed that if the patient is within that particular age, the prognosis is good, or alcoholic, non-alcoholic, bala? What are the factors that you consider, sir?
It's only that how their body responds to medication. That is the one thing. Second thing, how they are able to follow the strictly the discipline what that been given to them or given the prescription. And once they are following it, the things will set down. And age doesn't come in the way, because I have seen very bad prognostic things and even the very bad situations, even the very young patients. But even with the old patient also, they quite longly they stretch their lifespan with the medication. I have seen both the type of cases. So it's age may not be one thing, but important thing is the bala. If a person is having a sufficient body strength and bala, he may survive for some time, because in these cases usually they lose a lot of protein, and that protein also even dragged many times from the muscles. So that's why the upper part of the body, where above the diaphragm, becomes lean and thin, but lower the diaphragmatic area, everything becomes edematous. So that's the reason they lose a lot of protein from the body. So that has to be replaced. So if one who has lost a lot of proteins in the body, or dhatu kshaya has occurred, then there is a difficulty in bringing back him to normalcy or extending his lifespan. And that is one of the important thing that should be kept in mind. But generally, whenever a patient comes to me, I usually select all these things and criteria, and I'll convey them everything by systematically. And only once they're agreed, then I'll start a treatment. So doesn't make any sense that even a young boy may not survive, but an old person may survive. So that depends on how their body supports the medication and how they follow the treatment protocol.